I'm Dr. Ben Gaddie, and today we're at the Gaddie Eye Centers in Louisville, Kentucky. Currently, I am the co-chairman of the International Vision Expo conferences and also the executive vice president of the Optometric Glaucoma Society. Our practice is probably very much like many of yours. We have many optometrists in our practice. We have 4 offices, 11 ODs, and about 60 employees. And today I'd like to share with you some of the things around ocular surface disease and blepharitis that can really make a difference in your practice as well. So when I realized the impact of blepharitis and Demodex on my patients, and so I began looking for some type of treatment. And Dr. Schaefer Singh, who's a cornea specialist down in Miami, has really dedicated much of his life's work to this area of Demodex and how to manage it. And he found that tea tree oil, or terpenol, is really the active ingredient that's toxic to the Demodex that leads to the blepharitis. I realized that there was a lot of tolerability issues with the tea tree containing compounds, and the higher the concentration, the more toxicity that patients would feel, either from burning and stinging anywhere to developing an atopic reaction where they would have a lot of flakiness and crusting around the lids, which is really counterproductive to the blepharitis. So from there I began searching out treatments that were more tolerable and maybe even more effective than what we were using. And that's when I stumbled upon Lenovis and their product Blephadex, which is a patented blend of both tea tree oil and coconut oil. And that combination, which we'll talk about a little bit more later, has been very effective and most importantly very tolerable for my patients. So I don't have to worry about them going home and having an adverse event, stinging, burning, and just really not being adherent with the therapy because of the side effects from it. We feel like that the coconut oil may also have some sidal effects on the Demodex mites themselves, and it's also a great loosening agent. So as you get the cylindrical dandruff around the base of the eyelashes, which is really pathogenomic of Demodex, one of the problems is that cylindrical dandruff blocks the ability of the tea tree oil to get into the follicle and actually have its effect. So what's great about the coconut oil component of it is that it helps loosen all that junk around the lashes, for lack of a better term, and allows us to mechanically remove it and allow the tea tree oil to get in and really have its effect. The second thing, most doctors and patients are starting to learn the benefits of coconut oil or coconut in general, in terms of its hydrating effect and its anti-inflammatory effects. This preparation, you could literally pour it into the eye and it has no stinging or negative effects from a comfort standpoint. In fact, many dermatologists are now prescribing coconut oil and different coconut containing preparations for inflammatory skin diseases. So it really makes sense because blepharitis is really a manifestation of a dermatological disease that just impacts the eyelids as well. So it makes a lot of sense to incorporate in the coconut oil, and I think it's a really key component of the efficacy of Blephadex. So some of the benefits to my patients, besides the obvious efficacy that we just discussed, is the ease of use. And that, as you look at the different preparations that are out there to treat blepharitis, whether they contain tea tree oil or not, the ease of use is really key. Patients aren't going to use something that either hurts them or causes their symptoms to get worse or costs them a lot of money. They want something that's cost effective and easy to use that works. And that's been the beauty since day one with Blephadex. The tolerability is excellent. The ability of the patient to get it straight from my office is very important to me. So if you send them to the drugstore to get a lid scrub, there's 100 different products out there, most of which do not contain the tea tree oil, which is really sidal to the Demodex. And I feel like Demodex is the main cause for most patients' blepharitis. So I like that I can direct their care. They can purchase it from me, and obviously we do want to retail products in our office. We're a retail eye care practice, so it makes sense that we would carry it. And it denotes that trust that I'm the doctor, I'm prescribing it, and the patient is receiving it from my office. I think really not only helps with the retail side of things, transactional side of things, but also helps make sure that the patients are going to be more compliant and adherent to the therapy. Friends may ask them, why are your eyes so red? Why are your eyelids red? And many patients have had it for so long that they don't even recognize that their eyelids are red and swollen. So once we put them on the product, not only we take care of their primary symptoms, but aesthetically, when they look in the mirror, their face isn't as red, their eyelids aren't as red. And we know that rosacea, acne rosacea, is a very common cause of facial and eyelid redness. And we know that rosacea is caused by Demodex. 2 of the 4 subtypes of acne rosacea are caused by Demodex. So by using a preparation that kills the Demodex, not only do we get the ocular benefits, but we also get the facial benefits. And I'll oftentimes ask the patient just to go ahead and wipe some of the preparation on their face and cheeks. And it doesn't solve all the redness, but it really does reduce the burden. So what I would tell a fellow practitioner that's looking to integrate blepharitis and Demodex treatment into their game plan is to at least give Blephadex a try. In terms of the other products that are available, this is the one that's the most tolerable, it's the easiest to use, and you're going to see a benefit pretty quickly. So if this is something that you want to get into treating, this is the easiest bar of entry, is to just prescribe the once daily Blephadex, either the foam or the wipes or the warming wipes. Very simple for patients to do and very little work from the doctor's standpoint to ensure compliance.